Cancer was recognized as far back as Hippocrates, the ancient Greek physician who used the Greek word carcinos for crab to describe different types of tumors. Later, the Roman physician Celsus translated the Greek term into the word for the disease that we still use today, cancer. In the Middle Ages, apothecaries would treat the disease with fanciful ointments, and barber surgeons would excise tumors without anesthetic in unsanitary conditions. The discovery of general anesthesia in the mid-19th century opened the door for modern cancer surgery. In 1846, using ether, surgeons in Boston removed a tumor from a patient's jaw without any pain. In the 1880s, Baltimore surgeon William Halsted pioneered aggressive surgical treatment of breast cancer, the radical mastectomy, a brutally disfiguring surgery in which the entire breast and the surrounding lymph nodes and chest muscles were removed in an attempt to outpace tumor growth. This led to similar approaches to other cancers. For breast cancer, the Halsted was eventually followed by modified radical mastectomy that spared the muscles, then breast-conserving surgery. At the dawn of the 20th century, in 1903, doctors reported the first successful use of radiation to treat tumors, still an essential part of cancer treatment today. The use of anti-cancer drugs began in the 1940s, with the first chemotherapy drug ever approved, nitrogen mustard, a poison gas used during the First World War. It killed cancer cells by modifying their DNA, and its discovery spurred advancement in chemotherapy. In the 1950s, studies began to show a link between smoking and lung cancer, introducing the notion of cancer causers and prevention as a means of battling the disease. By the 1960s, smoking cessation campaigns had begun, and this became one of the most important strategies for reducing lung cancer. The 1980s and 1990s saw a number of cancer advancements, such as new chemo drugs and new methods for earlier screening of patients for the disease. In 2003, a significant development occurred. Scientists decoded the human genome, mapping the 3 billion DNA letters. This may help solve one of the great unknowns: what genetic defects fuel cancer, and set the stage for the next chapter in cancer's long history.